More than 14 million children and teens suffer from health problems as a result of obesity. And now for the first time in 15 years, the Academy of Pediatrics is taking a stronger stance on how to treat it. Dr. Bethany Atkins is with Baptist Pediatrics and is joining us live this morning via Zoom. Good morning. Thanks for being with us.
Oh, thank you for having me.
Would you explain, please, the new guidance as it breaks down by age?
Yeah, the new guidance is the first real guidance in the past 6 years, and it is very all-encompassing. It doesn't address below the age of 2. That's a whole separate section. But between the ages of 2 and around 12, or puberty, it really addresses the holistic approach of we're going to educate physicians and advanced practice practitioners on how to be more mindful and sensitive and treat obesity as the disease it really is. And then the biggest change is over the age of 12, there are now, there's a recommendation to have more, I just use the word aggressive, but actual real medical, whether it's medication or surgical interventions to help prevent future problems.
It's interesting. I read that, of course, yesterday also, and we chatted briefly. You know, bariatric surgery, it could very likely become a recommendation. Does that seem drastic, surgery in someone who maybe is as young as 12?
Surgery is drastic, that's for sure. But when we look at obesity as the disease process it is, it's a multifactorial. It's not a weakness. It is not a failure of personal being. It's partly genetic, it's partly epigenetic, it's partly affected by external forces, the social determinants of health, a variety of issues. And if all modalities, longitudinal modalities of addressing diet and giving them access to healthy foods and exercise, when that's not working and we start seeing medical problems that usually we think of related to adults, but when they're already showing up in young or middle teenagers, it's time to do something.
So how will your conversations now change with parents and teens about body weight? And I ask that question, as a parent of a boy and a girl, and, girls in particular can be very sensitive about their weight, and that can really be a difficult conversation to have because you certainly, regardless of having a boy or a girl, do not want to somehow give a child a complex about their body image, which feels like they're constantly surrounded by this image of size 0 is the prettiest and most beautiful.
Exactly. Unfortunately, what's portrayed on media and online is not necessarily healthy. First and foremost, the recommendation they made was ask permission. Let's talk about this, but let's do it from I want you to be healthy, not this is the number on the scale. We use the body mass index to really classify whether they're overweight or obese. But we're more cautious about using words that are offensive, like morbid obesity. We call it severe obesity to reflect the fact that this is a disease.
I think it's so important to just kind of start the conversation, and clearly this is a conversation that will be had over perhaps a couple of years. But instead of the wait and see attitude, which I think the American Academy of Pediatrics is saying that's just not working as much anymore. Your final thoughts to parents who may be unaware that there might even actually be some medication that could help their child who maybe is struggling.
Right. If nothing else, I think this gives hope, because many times we see that, as with other disease processes, this runs in the family. So we're dealing with parents and grandparents and aunts and uncles that all are dealing with obesity. To them, it just seems like a foregone conclusion. There's no help. Well, this is a glimmer of help, that it's not the panacea. It's not going to solve everything. And we don't jump straight to the really more drastic, to use the word, treatment modalities. It's a process, but there is hope now that we may be able to turn the corner and end the obesity epidemic. We're dealing right now with about over 14 million children in America alone that have this disease. And yet, exactly what you said, it was the wait and see or the hands in the air, was nothing we can do about it. That's just the way it is.
Be interesting to see what happens over the next several years. Dr. Bethany Atkins, a local pediatrician with Baptist Pediatrics, joining us this morning. We appreciate your insight.
Oh, thank you.